Hi, I'm Jackie Thelian, and welcome to Key Coding Tips. Today we're going to talk about the new conventions in ICD-10. Many of the conventions in ICD-9 have remained the same in ICD-10. However, there are a few updates and new conventions that we want to talk about. You'll recall that in ICD-9 we have an Excludes 1 note. Well, we also have the Excludes 1 note in ICD-10. However, we also have an additional Excludes 2. With the Excludes 1, the coder is alerted that these two diagnosis codes would never be reported together. For example, a congenitive form of a disease would never be reported with an acquired form of the same disease. An Excludes 2 indicates that in these cases, the patient may have both conditions. And if that is the case, and it's supported with documentation, you may code both conditions. Let's take a look at an example. In the case of a lesion of the sciatic nerve, we see that it excludes sciatica. So we would not report the sciatica along with the lesion of the sciatic nerve. This makes perfectly good sense because if we were to do so, we would be reporting the sciatica twice. However, in the Excludes 2, you'll notice that if the sciatica is attributed to an intervertebral disc disorder, you would report both the lesion of the sciatic nerve, the G57.0, and the sciatica attributed to the intervertebral disc disorder, the M51.1. And both of those codes, by the way, would require additional digits. ICD-10 also brings inherent in the code itself laterality. So the right side would always be reported or ending with the character number 1, the left side number 2, and in cases where we have a bilateral code, it would be reported with 3. If ICD-10 does not provide a bilateral code and the illness or injury is bilateral, you would assign 2 ICD-10 codes, one for the left and one for the right. Remember, you still need to report the appropriate HCPC, LT, or RT modifier to the CPT procedure code, and you'd want to make sure that that modifier actually corresponds to the laterality in the ICD-10 diagnosis code that was selected. Here we see an example of a malignant neoplasm of the lower outer quadrant of the right female breast, and we see that this code ends with the number 1. In the second bullet here, you see that we're talking about the left breast, and that ends with the digit 2. And again, in ICD-10, we do have unspecified codes, so in this case, if we're not provided with the left or the right or the laterality, we can always choose that unspecified code, in this case ending with the digit 9. ICD-10 brings a wealth of combination codes, and this is great as it helps to reduce a lot of that multiple coding that we would be dealing with ICD-9. Here we have an example of diverticulitis of the large intestine with perforation. And now we see with ICD-10, it includes, if applicable, the abscess and the bleeding. Check out the codes for poisoning. Remember how many codes we need to use to report poisoning in ICD-9? Well, here, inherent in the code, we now see not only the drug taken, but the circumstance. In this case, intentional self-harm. And yes, the lady in the picture scares me too. One of the big changes for obstetrics is the fact that we now need to report with each of our codes the specific trimester of the patient. ICD-10 also brings along many codes which now include clinical concepts. For example, we can identify specifically the person's blood type and even the patient's blood alcohol level. Many of the codes in ICD-10 have been expanded. As mentioned earlier, this helps to reduce that double coding now required in ICD-9. Now the diabetic codes also include the manifestation. And here we see diabetes mellitus with proliferative diabetic retinopathy without macular edema. We now say this with one code. In ICD-9, we would have been required to report 2 codes. Also, we can specifically identify the type of breakdown for heart valve prosthesis. Also, we're now able to make the distinction between an intraoperative and a postoperative complication. And here on the screen, you do see some examples. And last but not least, remember to please check your definitions in those additional character boxes. A lot of us who've been out in the field coding for a number of years have that knee-jerk reaction. We just know the definition of that additional code that we're going to append. However, take note, in ICD-10, some of these have changed. So, for example, we see here that an acute MI is now defined as 4 weeks instead of 8. So there you have it. And as you start to use ICD-10, you'll notice that the process of looking up the codes is exactly the same as it is in ICD-9. There have only been some changes to the guidelines and the coding conventions. If you have any questions, please enter them in the comments section below. And remember to stay updated and subscribe to Key Coding Tips. Thank you for watching.